Hi, I'm Andrea, and I'm starting a vlog for my journey through trying to conceive a baby. I'm dealing with infertility and recurrent miscarriages, and there's some reasons behind that, and some things I think don't have quite explanation for yet. So there's a lot of factors going into it. I'm basically doing this video as an introduction, so anyone watching my videos after this will have an idea of where I'm at in that journey, because I'm pretty far into it at this point. So I think just an introduction would be a good way to start. I have a blog on Blogger. I'm Cafe Babe on there as well, the same as my YouTube name. And I've been keeping that blog since 2011, I believe. That started out as just a blog about everything in general and kind of became a blog about conception and things like that, and infertility and all that jazz. So if you are interested in going back and reading that, like I said, it goes back at least about 2.5 years, I think. So that is there. It's available. To introduce myself, like I said, my name is Andrea. I'm 24 years old. I'm from Erie, Pennsylvania. My husband and I have been married since March 26th of 2011. My husband's name is Kellen, and he's 28 years old. So we got a 4-year age gap there, but nothing big. We have been trying to conceive since we got engaged, roughly. And that was in November of 2010. Right now it is January of 2014, so we're at over 3 years at this point. My history goes back into about 2001. I was 12 then. That's when I started showing symptoms of PCOS, which is polycystic ovarian syndrome. I was not diagnosed then. I was tested, and even though the numbers on my test, the blood work all came back saying, yes, she's within the range for this, my doctor didn't feel comfortable diagnosing me then because she said that I was too young, that there were other reasons for hormonal differences. And really the research on it is not quite there. There's a lot of controversy about still what causes PCOS. I have my own theories, but I'll probably talk about that in another video. Because I've done a lot of research on it myself, particularly in college, even with the help of some science and med majors. So I do have some background there. Like I said, I'll talk about that hopefully in another video. I really intend to do that. So I wasn't properly diagnosed with PCOS until I was 16. So that would have been 2005. When I was diagnosed, I had a whole bunch of blood work done. I also had an ultrasound of my ovaries done. I have atypical PCOS. It has a bunch of different names. Atypical is usually what I call it, it's just easiest for me. Because I do not have polycystic ovaries. Now, how can you not have polycystic ovaries but have PCOS? It's not that uncommon, really. It is more common to have polycystic ovaries, but it's not uncommon for it to happen that way. What that means is that I'm declared as having PCOS because of the numbers in my hormone levels. I'm considered estrogen dominant, so I have an abundance of estrogen and a very low progesterone count. I also have high testosterone, which is male hormones. I don't know how true this is of me anymore. Things have changed with me a lot lately, so I haven't had it tested lately, and I'm kind of leery to do so. As far as my PCOS symptoms go, you know, I have quite a few of them, to be honest with you. I've had trouble with my weight ever since the PCOS kind of began. I gained 30 pounds out of nowhere when I was 12 in a matter of a couple months. And that was one of the big things saying there's something wrong here. So I've struggled with weight a lot. I have some of the more cosmetic symptoms as well. Extra hair on my arms and stuff like that. And it's not pretty, but it is what it is. As well as infertility. And that's what I'm here to talk about. I was told when I was 16 that it would be very difficult for me to get pregnant because the only thing they could give me to control my PCOS was birth control, which I stopped taking when I was 20. So I was on it for 4 years. I did not like what it did to my body. I gained even more weight on it. I've had other issues with weight gain, with emotional eating and stuff like that. So it's not just that. I'm not just blaming the diagnosis, but that does have something to do with it. So through 4 years of taking that, I had a lot of problems. I got a lot of yeast infections from them, and had a lot of depression from them as well. That was not typical of me. So I decided to stop taking them. I decided on my own, like, I'm done with this. And between the time I was 12 and 20, I was without birth control. I was having periods once or twice a year. When I stopped taking the birth control, within 6 months, I started having periods, but menstrual cycles were very long. They were typically around 40 days. You'll hear commonly that a normal cycle is about 28 days. Between, I think, 25 and 36 or 35 is what they say is normal, I guess. So obviously mine was very long. Even when I started having fairly normal periods. So from the time I was 20, I kind of just went off the meds, didn't worry about it, didn't think about it. I was engaged to another person then, and I was in college. I had a lot of other things on my mind, so it kind of wasn't at the forefront. I met my husband now while I was in college. And after I graduated from college, I moved in with him. We got married, like I said, in 2011. So we're coming up on being married for 3 years. Like I said, we started trying to conceive as soon as we got engaged because he knew how difficult it was going to be for me with having PCOS and having them say, well, there's not really a whole lot we can help you with because it's all hormonally what's causing your problems. You don't have polycystic ovaries. We can't do anything about that. Basically, it was like, we don't know what's causing this. We don't know what to do about it other than to give you birth control when you want to get pregnant. You need to see a fertility specialist, so on and so forth. I was told that it would be easiest for me to have children before the age of 25. I am 6 months shy of 25 now. It's not going to happen. So I'm not seeing it as a cutoff. It is what it is. It might be more difficult. Who knows? It's already been difficult. I started trying to have a baby when I was 21, and it hasn't happened yet. The other end of it is that I have been pregnant twice. I got pregnant at the end of May in 2011 and miscarried in August of 2011. I was about 10 weeks pregnant when I found out that the baby had stopped developing. There was a whole myriad of problems that I'd had. I'd had bleeding and cramping, and I'd been in the hospital for it. And I was not very well cared for. I was given synthetic progesterone, so progestin, to take to prevent a miscarriage, which at the point that I was at when they gave it to me, it was too late anyway. It shouldn't have been given to me, apparently. And that just complicated matters as far as the miscarriage was concerned. But when I was given that, I didn't have another appointment for 4 weeks. So they didn't do any monitoring on it for 4 weeks. And by that point, the baby had stopped developing, and it was clear that I was going to miscarry. I decided to let it happen on my own, partly because I couldn't afford to have a D&C or anything like that, and partly because I just wanted it to be a natural thing to let it go on its own. I ended up hemorrhaging pretty badly, and had to be in the emergency room and be stabilized. While I was bleeding that heavily, I was in a severe amount of pain. The amount of pain that I was in, I was told by my OBGYN that it was far worse than what labor pain is like. And she said that's partly psychosomatic because you don't see any end to it. You know, there's no baby that's going to be coming out of it. And it's partly also because I was hemorrhaging. There was a huge problem there. When I got to the emergency room, my blood pressure was extremely low. I was dehydrated. I was in very bad condition. It was definitely one of the worst experience. It was the worst experience of my entire life. And for a while, I didn't want to try to have kids again. I just wanted it to be over. I didn't ever want to go through that again. I ended up getting pregnant again in January of 2012, and I miscarried in February of 2012, just a couple weeks after I found out I was pregnant. I didn't even get to an appointment for that. When I called and told them I was pregnant, they said I wasn't far enough along and they didn't need to see me. So I ended up miscarrying before they even saw me. I don't know if there's anything they could have done about it, but I was not too happy with the OBGYN office, who's basically like, yeah, we don't care that you had a miscarriage before. You'll be fine until you're this many weeks or whatever it was. I can't remember exactly because I've been so angry about it. They technically don't call it recurrent miscarriage yet because I haven't had a third one, but that's because I haven't been able to get pregnant since then. My first pregnancy was actually twins. Nobody found that out until I did. I passed one baby. I'm always going to call it a baby. I don't care how far along I was. I was at the hospital hemorrhaging, and another one the next day after I'd come home. So that's how I knew that it was twins. I found out that on my own, and I think that made it even more difficult. The second one, as far as I know, was just a single. I really have no idea because I knew nothing about it. I just started bleeding really heavily one day and bled really heavily for about 2 weeks. And then it was done and over, and I didn't have another period for like 5 months. It was awful, but not nearly as awful as the first. They won't tell me for sure why I had miscarriages, but I know that my progesterone level was still really low, and that's probably the cause of it. That comes along with PCOS, obviously. I decided after my second miscarriage that I just was gonna kind of chill, let whatever happens, happens. I started in April of 2011, completely overhauled my diet, cut out red meat, cut out pop, cut out a lot of sugar. I use stevia as a substitute for the most part now. I still have sugar from time to time. It's not like I've totally eliminated it. I eat very little dairy. I drink almond milk instead of dairy milk. I eat cheese every once in a great while. I just eat chicken and fish as far as meat is concerned. Absolutely no red meat, no pork, nothing. Chicken and fish, that's it. And as fish goes, I just kind of do salmon, and I eat tuna fish, which I know apparently isn't that good either, but I don't do well without a lot of protein. I eat a lot of nuts, a lot of pasta that's better for you, so I do a lot of I do a whole grain pasta, so I think the stuff I have right now is kamut. I also have done soba noodles, that's buckwheat. That has a lot of protein in it and is better for you, so I like a lot of that. I do a lot within the Mediterranean diet as well. using a lot of olive oil, good olive oil. I kind of adopted, I'm not trying to do any diet specifically, I'm just trying to eat better. Ever since I started doing that, I've lost about 40 pounds. My periods are pretty normal at this point. This most recent one was 28 days, the gold standard, 28 days. I'm pretty excited about that. The past 3 before that were all 31, so they're normal. I've been ovulating as ovulation tests tell me. I actually missed my last ovulation because I started testing too late, thinking it was going to be another 31 days, but it wasn't. It was only 28. So things health-wise seem to be getting better for me, and I'm hoping that means that, sometime soon I am going to conceive and carry a pregnancy. We'll see. That's part of what this is for. For a while, between January and September of 2013, I was taking Vitex, also known as chasteberry, to help regulate my periods, which it did. It took them down from like the 40-some days to, it was in the 30s for a while, and then it went down to 25, and then the one after that was 42. And I know an herbalist who told me, she's like, it sounds like it's run its course, go off of it, see what happens. And ever since I've been off of it, like I said, I've had 3 31 days and 1 28. So obviously things have worked themselves out in terms of that, so I'm really, really happy about that. I'm trying to do everything on my own. I don't want doctors involved, really. I've not been treated well by them. I've been soured to them. I talk about this later on, but I don't want to do anything that requires anything invasive. No in vitro fertilization, no fertility drugs even. I don't want any of that. I'm trying to do everything naturally, and I'm happy with the decision I made so far. I still struggle, and it's tough, but I'm 3 years into this, and I'm not giving up. So basically, a summary of what I've been through is I've had PCOS since I was 12. I've had 2 miscarriages. I'm calling them recurrent miscarriages because I've had 2, and I imagine if I would have gotten pregnant again prior to my weight loss, I probably would have miscarried again. I'm not defined as recurrent, but it is what it is. 2 miscarriages is pretty serious, especially when you're only 24. My husband, as far as we know, is healthy. He's 28 years old, like I said, so, I guess in terms of fertility, he's getting a little older, but not really. Me, I guess I'm still technically in the prime of it, despite all that I've been through and all the issues I have going against me. At this point, we're thinking about looking into adoption. We haven't ironed out all the details yet, but we're going to keep going forth with trying to conceive. Right now, I'm not using any supplements. I did take Vitex and chasteberry. The only thing I'm using now is prenatal vitamins to make sure I'm getting enough folic acid and B vitamins and iron. I also take calcium and vitamin D supplement as well. I've had low vitamin D levels in the past, so I continue to take a supplement for that. And basically, this whole vlog is going to be about my journey through trying to have a baby, continuing on with that. I'll probably talk about other things too. I can get very stressed out with it, so I know that I mention things about what de-stresses me, and that's a lot of things. You can probably see some of it around me. That's a Master Chief on that poster back there. That's actually Caboose from Red vs. Blue. I have Link from The Legend of Zelda on my shirt. I'm a very interesting person. I think to a lot of people, like I went to high school or college with, they would think I would be the last person who would desperately want kids, but I've always known that I wanted them. It's been my dream since I was a little kid, and I've never backed down from it. I really, really, really want my own family, and my husband and I are doing everything we can to make sure it happens, everything under our power without getting other things involved, because that's not what we want. So I will talk more about my PCOS. I will talk more about dealing with pregnancy loss. I will talk more about trying to conceive after loss, trying to conceive and having issues while being fairly young. All of this I want to talk about because not only does it help me deal with all of these things, because it's very hard, especially when I don't know a lot of people my age who've been through this. I know there are others, but when you're 24 and you can't have a baby and you're seeing all your friends being able to do it, it's very, very isolating and very, very tough. So I will talk about that as well. And I'm doing this because I'm sure there are other people out there who are like me, who are also struggling and also looking for other people who are in their position. And I want to help other people as much as I can. That's one of my things that I do. I am a TSS, therapeutic support staff, so my job is to help kids. And there's stresses that come along with that, but it's also one of my passions is to just help other people live the best they can. So that's why I'm doing this as well, for myself and for others. And I hope that you enjoy this journey with me. I'm really excited to start doing this. Hopefully, all the posts I'm doing won't be this long. I'm hoping to have some shorter ones that are just on single topics. But I wanted to get this introduction out to let you know where I'm at right now. So I look forward to talking to you all in the future. Please feel free to comment, ask questions. I would be glad to hear from people who are listening. So I hope everyone's staying warm in this terrible January weather, specifically if you're here in Erie with me, where it's a lovely 8 degrees and there's about 1.5 feet of snow on the ground. So stay warm, enjoy the winter weather if you can, and we'll be talking soon.